Hello, and welcome to Health Matters, a show about the health issues and interests facing our community. I'm your host, Gilda Kramer. I'm a Lower Merion Township Commissioner, and I chair the Board of Commissioners Health Committee. Today, we're going to be talking about dental medicine. My guests are Dr. Rossman. He's a diplomat of the American Board of Endodontics, the past president of the American Association of Endodontists. He's worked at Albert Einstein Medical Center. He's a member of our Health Advisory Council, and he's a Bala Cynwyd resident. Dr. Howard Fraiman is a clinical associate professor at the Department of Periodontics and the program director of periodontal prostheses at Penn Dental Medicine. He has a private practice in Philadelphia and Paoli, and he also lives in Bala Cynwyd. Dr. Tara Sexton is the clinical assistant professor at the Department of Restorative Dentistry at Penn Dental Medicine. She also has a private practice in Bala Cynwyd, and she lives in Villanova. Now, you all have specialties in endodontic, periodontic, and restorative dentistry. What do those terms mean?
Well, I can start. Endodontics is the field of dental medicine that saves the natural tooth. Endo inside, we remove diseased tissue inside the tooth and restore it to good function and good aesthetics once we are finished. So it's saving the natural tooth.
Periodontics is the specialty of also saving teeth, but it has to do with the environment around the gingiva or the gums. So whether you have gum disease or need dental implants, periodontics is associated with that. And prosthodontics is the replacement or restoration of missing or damaged teeth.
Dr. Sexton, what is restorative dentistry?
Restorative dentistry is the act of saving teeth as well when you possibly can and restoring them to form and function. So shapes, sizes, dimensions, colors, if they've darkened, there are many different things, but it's about bettering the tooth or restoring it to its natural state as best as you can.
Let's talk a little bit about dentistry during the COVID-19 pandemic. Dr. Rossman, how does the dental office, doctor, facility, and staff compare to pre-COVID-19, post-COVID-19?
Well, dental medicine took a major change when we were dealing with HIV. When we were confronted with HIV, dental medicine really turned up the ability to sterilize, clean, and keep everything in a very aseptic environment. With COVID, we became even more so that way. Personally, I went into the office every morning, cleaned everything, wiped everything down, because in the beginning, no one knew where the transmissibility happened. But it became a very safe environment, extraordinarily careful for our patients and taking care of every aspect of clinical dentistry. So our patients were safe, and our staff and ourselves are safe.
Is there real communication between the CDC and the dental profession?
Most of the communication that we received was through the Pennsylvania Dental Association, the American Dental Association, and other similarly affiliated dental organizations. Through the CDC directly, not so much, but they were communicating through our dental associations. There was also communication through legislature and people who govern in our state and in our local communities.
Dr. Sexton, do you think that dental practices are safe right now?
I think dental practices are doing very well because of our preparation that Lewis mentioned for the HIV epidemic. We were prepared beyond most practitioners to put barriers between ourselves and the patients and between affected patients and other patients and staff. So I think we were ahead and had a leg up by accident in a way because of those preparations that we made back in the late 80s.
Should people be delaying their dental visits until they're fully vaccinated or we have herd immunity, or should they be going to the dentist now?
I'm going to chime in. I think they should be going to the dentist now. They should have been going to the dentist all through COVID. It's a very safe environment. The protection afforded to the patient and to the practitioners and to the staff is extraordinary, as Dr. Sexton and Dr. Fraiman said. But people can't let their disease go, and dental disease progresses. It doesn't stop because of COVID. It will get worse and worse, and you can get these problems taken care of in a very early stage. So very preventive, for prevention, you should go to the dentist.
What should family dental needs be during this period?
I would say keeping up with your regular cleanings to make sure that things stay in order as much as you can. I know that one of the issues was patients' comfort level, which was very diverse. Some people came in with emergencies, like real emergencies, were repaired temporarily. And then once we began to clean things up and become more safe and protected, we were able to go beyond that and welcome patients in for regular restorative treatment and cleanings.
Is it safe for children to go to their appointments when they aren't vaccinated right now?
I would say certainly it's very important, especially with children. You want to, if they have any early decay and early dental problems, you want to sort of nip it in the bud. You want to get it before it gets too deep. It's overlooked. Dental disease progresses. You don't feel it until it gets to be almost beyond recognition, in the sense that you'll need a root canal, you need a crown, you need a restoration. You can prevent all the advanced problems by going and progressing through the year by going and taking part in your 6-month evaluations.
Have dentists continued to teach at dental schools during this COVID period?
Yes, they have, and we have. Somewhat depending on the dental school, but here in Philadelphia, the schools have been open and they've been adhering to some of the same standards and guidelines that we've set up in practice. They've become very safe environments for the patients, for the staff, for the dentists. And we've been fortunate enough that we've been able to keep teaching during this period.
I'm sorry, I'm going to have to interrupt our conversation, but we do have to take a break. We'll be right back with more about dental medicine on Health Matters. Stay tuned. Welcome back to Health Matters, a show about health issues and interests facing our community. I'm your host, Gilda Kramer. I'm a Lower Merion Township Commissioner and Chair of the Health Committee. We're talking about dental medicine and how it has been affected by the COVID-19 pandemic. Dr. Fraiman, what should the patient's responsibilities be during the COVID-19 pandemic?
Well, I think their responsibilities are similar to what they were before the pandemic. They have the responsibility, which is their at-home care, which should be the same. And then the responsibility of seeking out the preventive care we can offer in the office. For some people, that means twice a year. For some people, that may mean 3 or 4 times a year. But, as we've discussed, it's very safe, the environment that we've created, that we've always been familiar and working with. And I think that the responsibility remains the same for the patient.
Can you recognize a dental emergency that somebody really has to go in no matter whether they want to go or don't want to go?
So I think the most telling signs revolve around pain or discomfort and swelling. Those are probably the signs or symptoms that someone may experience at home that would trigger a response where they may have to seek care, whether they've been seeking their preventive care or not during this period. But anything that's uncomfortable, that seems like it's swollen, is certainly reason enough to contact a dentist.
Pain is a predisposing factor. It's going to tell you that there's something going wrong and you should see a dentist ASAP. But swelling can be life-threatening, and swelling has to be dealt with and cannot be ignored. So someone who's fearful of going out because of this virus really has to take hold and go and seek proper dental care. It's perfectly safe to go into a dental office.
Dr. Rossman, do we have fluoride in the water in Lower Merion Township?
We don't have fluoride in the water. It's an excellent question. We don't have fluoride in the water in Lower Merion Township. So I'm going to ask Dr. Sexton, who deals with lots of children, to deal with what the concentrations are and what the responsibilities are. But what's interesting is we have found on the Health Advisory Council many wonderful pediatric pediatricians are operating at CHOP, and some may not recommend fluoride for the residents of Lower Merion Township because Philadelphia fluoridates their water, Lower Merion doesn't. So it's really a responsibility left to the parents, to the physicians, and to the pediatric dentists and general dentists. Tara, would you like to say something?
Yes, and in fact, it's a critical point because it's the standard of care now. So it is regarded as something that starts at 6 months of age. Provider, healthcare provider, pediatrician, pediatric dentist, physician, depending, would give those prescriptions to the parents to help take care of the children until they were able to do it themselves. And the dental school dean at Penn now, Dean Wolf, is actually also recommending adult fluoride treatments, which is a new thing. And his philosophy is that once a tooth is, if there's something started as decay, it's starting and going until you do something to stop it. So we don't want it to get to the point where it's decay, where it needs restorative treatment, where there is pain, where there is swelling. So we intercept at a young age now, and it's very safe. It's FDA, ADA approved, and it's important for everyone, and now even adults, according to the dean.
And ADA is the American Dental Association, and that's our parent organization.
So you said that fluoride treatments for children should start at 6 months?
They're given as fluoride tablets, typically by the dentist or by the pediatrician. And sometimes also they have a solution for the youngest children, and then it will turn into pill as soon as they're able to swallow the pill and not use the liquid.
Well, what's the best way for somebody to find a good dentist?
So that's an interesting question, right? There's lots of good dentists in our community in the Philadelphia and surrounding areas. And I think the best way to find a good dentist is probably through word of mouth, right? Through friends, through family, through people who've had good experiences with dentists. And many people, as you know, have dentists. And you talk to people and you find a dentist that may be a good match for you, right? Based on what you're being told by your friends and family and what you're looking for.
We're lucky in the Philadelphia area because good dentists come from good dental schools, and we have wonderful dental schools in Philadelphia. So we are very fortunate to have well-educated, well-trained dentists.
Do most dentists take dental insurance?
So dental insurance has different layers to it. So it's really, the dental insurance is about reimbursement or how someone is reimbursed, whether it be the dentist or the patient. So when you say take dental insurance, like I said, there's different levels. So some dentists may participate fully with the dental insurance company where they accept the dental insurance payment as their complete payment. And other practitioners may take their dental insurance in the sense that the patient is still responsible for the fee, but they will help submit and use that insurance for reimbursement. So I think there's different levels and there's misnomers to what taking dental insurance really means.
Well,
I make a comment that many times dental insurance does not cover the overhead of a good restorative dentist, does not cover the overhead of a good endodontist or periodontist or any other specialist. But dental insurance could be looked upon almost as a discount. If you have it, I would say utilize it against your fee as a discount on the fee because you're going to get reimbursed from the insurance company. But you're not going to make a profit if you go out and try to get the most wonderful insurance plan. It's just not going to benefit the patient.
What should I, the patient, look for to evaluate a dentist?
I would look for education where they were trained. I want to know if they're teaching now. You have 3 people here that represent teachers from different institutions, and we keep up with things, and you want to make sure that your dentist does too. And there are different specialists that do general dentistry and people that have taken training following dental school. So you want to really evaluate the qualifications of the person. Make sure they've graduated from dental school, going on to exercise their skills, develop their skills.
Thank you so much. I'm going to have to interrupt again. We have to take another break, but we'll be right back with more on dental medicine on Health Matters. Stay tuned. Welcome back to Health Matters, a show about the health issues and interests facing our community. I'm your host, Gilda Kramer, a Lower Merion Township Commissioner and Chair of the Health Committee. We've been talking about dental medicine, and now we'd like to talk a little bit about how the COVID-19 pandemic has really changed dental medicine. Dr. Sexton, can you tell us how COVID has changed dental medicine?
One point that I think is very interesting is there was a period of time when everything got shut down that dentists were forbidden from treating patients, and we became non-essential. And health matters, right? That's why we're here. That's why we're talking about all of this. So that period of being non-essential was a very defining moment that brought us back into the medical world as part of that team that takes care of each person. And I really think that was an important distinction. And so many things happened during this chaos. People were really stressed out. So I like some of your other programs that you've done, taking care of yourself, resources and things like that you were talking about. But people were grinding their teeth. They were stressed out. While they were sleeping at night, they were breaking fillings, breaking teeth, cracking things because the intensity of all the things that they had to do each day to work or take care of children or take care of a parent or teach, or one of the many millions of things that we do every day, was just this cloud was hovering over everyone. And I think even when people went to sleep, some people weren't sleeping well. And even the people who were sleeping well were grinding their teeth and hurting their muscles, hurting their jaws, hurting their teeth, their tongues, their gums, trying to stick their tongue in between their teeth to bite on it just to relieve the stress. So I think those were some critical points that were interesting, and that continues now. People are coming out now and coming to us, the ones who are becoming more comfortable and probably who were most scared are now coming and saying, this has been broken since last May. How much damage have I done by it being left by then? I was just scared. Not of you, not of the treatment. I've been a patient here for a long time, but I was terrified I might catch something or pass it to my mother, who I'm taking care of now.
Well said, Tara. I'd like to just add one thing that we can save just about every tooth in the mouth. We can't save a tooth that's lost all the bone around it, and we cannot save a tooth that's cracked down the middle. And we have seen more of what we call COVID fractures this year than any other year in our professional lives.
They have a name now.
COVID fractures. Have cosmetics been an issue as more people are on Zoom?
For sure.
Yeah,
for sure. We're seeing, as Dr. Sexton mentioned, we're seeing a lot of dentistry due to stress and grinding and clenching, fractured teeth, COVID fractures. And then we started seeing people getting introspective about their health and wanting to seek dental care who haven't seeked out dental care before. And we're seeing the whole thing with cosmetics and aesthetics. People looking at themselves in the Zoom camera all day, or looking at themselves on meetings or interviews like this, noticing their smile. What's the first thing you see is the smile generally. So there's definitely been an increase in awareness of the value of dentistry, not only for function, but for aesthetics.
And I've heard from colleagues, a lot of people are rushing to their plastic surgeon. They're getting Botox, they're getting fillers. and doing all that, because you kind of forget when you're away from a mirror working and dealing with people all day, you forget what you look like. And then you look in the camera 8 hours a day. If that's your job, that's not what we're doing. But if that's your job, you're looking and going, oh my gosh, look, oh, I have to get that taken care of. I got to go color my hair.
With all of this and all of the disruption that and extra precautions that you've had to take, is dentistry still a good profession right now?
It's a great profession. It's a great career. It's been a great ride in the sense that it brings it all together. It brings the human body, brings biology, brings microbiology, brings all the sciences together. Plus, we have interaction with patients, and we're doing procedures to help people all day long. It's you have personalities. You have dealing with patients. You have procedures that you love performing, and you also love getting people to a state of health and helping them. So it takes us into schools to teach. It takes us into rooms. It takes us onto television. I mean, what more than television?
I mean, really well said with that, right? It's a health science where we're helping people, but we're with people, and that's the most important part, right? We're interacting with people. We're with grateful people. We're with people we learn from, who give us different perspectives on things. And really during COVID, I view us as being really lucky, right? We got to, after the shutdown and we were allowed to reopen again about a year ago, we were the lucky ones who got to go to the office, got to go to work every day, and didn't have to sit at home in front of a screen. And I would leave house with a wife and kids who were on Zoom all day. And I said, I'm the lucky one. I'm getting to go see people right now.
And the relationship is close. We're close to our patients physically. So they open up and they talk to us about things that are bothering them, or tell us funny stories, or tell us something about their families, or their daughter who just graduated, or someone had a baby. Like, this is good stuff. You develop a very close relationship with a lot of your patients. And on top of all the other things that Howard and Lewis said, we get to go to art class. We're fixing these things. So we get to imagine, we get to remember what the tooth looks like and how it should be, and put our little initials in there, our care for that person. It's personalized. And that feels good, really good.
And no one sees my root canal, but I've seen the x-ray of the root canal, and I think it's beautiful.
And we do too.
So,
Thank you.
is every dentist trained to perform any required procedures?
Yes, for the most part, the first part of dental education is going to dental school, which is to teach you to be a general dentist. So in the general dentistry aspect of dentistry, we're trained to do most procedures.
So when should a patient seek the advice and expertise of a specialist?
That's a great question. But a specialist specializes and becomes a special person who is knowledgeable in the literature, knowledgeable in the clinical approaches, and the general dentist can do just about everything. But if something goes wrong, they don't know how to get out of it. And people have to learn their limitations.
And this is a philosophy. This is a mindset. I want to send someone to get a root canal to someone who does root canals every day of the week in case something goes wrong. They know best how to fix what's happened.
The same thing with cosmetics, the same thing with prosthodontics, the same with periodontics, oral surgery, all the specialists.
Yeah, couldn't agree more, right? You want people to be able to seek out the best care possible. And it's part of what we do, right, in our relationship with people to make sure they're getting that type of care.
Well, that's all we have time for on this month's show. I want to thank my guests, Drs. Louis Rossman, Howard Fraiman, and Tara Sexton, for being here and sharing their expertise about dental medicine. I'm Gilda Kramer, and I'll see you next time on Health Matters.